I was just asked.
There we go. Okay.
So you have become aware that they just started the recording. So let's just go back for a minute saying that we are going to be discussing this morning both programs, the Masters of Science in Information Science with a concentration in health librarianship, as well as the Master of Science in Health Informatics. And as I mentioned before, it is one of the things is that both of these masters have national ranking, which means that the profession has recognized the value that we have in our curriculum. So saying that, you will say, okay, why is it that I'm choosing this particular profession? Both of these programs that you have come here to North Texas for, they both have a common thread, and that is going to be dealing with information and data. Both fields that we're going to be dealing with, it deals with both a huge amount of information and data. The most important is that our goal, it is to have an impact in the healthcare field, focusing specifically on the patient. We are patient-centric, regardless of the work that you're going to be doing, whether you're going to be software development, where you're going to be putting information at the point of care for a physician or for the consumer health information. The main point that we want in here it is that how is it going to impact the delivery of health services specifically for a patient? So saying that, you were going to say, the fields that we're dealing in here is that it's going to be a combination, I would say, of technology. It's very important that you know that, as well as the information aspect to it. It's a very interdisciplinary field, which means that it's drawing from different disciplines. We're going to come from the information science, different from data science, from computer science. But most important, will be the specialization that you're going to be dealing with. That is going to tell you also pull from that domain. Are you dealing with health? Then you will have medical informatics. Are you going to be dealing with the field of nursing? And then that will be nursing informatics, dental informatics, pharmacy. Pharmacy right now is taking a front row, and we're very pleased that we have many of our students that are coming from that subject domain. And it's giving us a very in-depth perspective of what goes into the discovery, for example, of drugs. What is the research and development aspect to it? And what is the point that you come in as having a degree from us in order to contribute? The main thing here it is that you're going to have a toolkit. We're going to give you a knowledge base. We're going to equip you with skills and competencies. And then it's up to you, how is it that you apply this in the healthcare industry? And when we say the healthcare industry, it is a very broad umbrella of what we're going to be providing you here with. Reaching all the way from, like I mentioned, pharmaceutical company, you were a software development company, you might be in research institution, you might be working in libraries that they're dealing right now more and more embedding these data science analytics processes. So that's the first thing that we want to take. So you're going to say, if I come here, will there be a place for me? And this is what it makes it so attractive, because there are a place for all of you, whether you are interested in the clinical side of the field, or you're interested in the research side of the field, or you're interested more in concentrating on patient care. So we have different arms that there's going to allow you to do this. Now, one of the things that we want to tell you is that, okay, so I am doing in these three aspects to it. The field is very fluid. So if you're one person that likes that excitement or something that is always moving forward, you are in the right place, because you are aware, even from the news media, they tell you the new development that we have in technology and what are the issues that they are getting involved. So when I deal with issues, I have mentioned that you deal with clinical, you might be dealing with research issues, but also one of the things that it makes attractive to some of us, it is that they have social issues as well as technological issues. In terms of social issues, for example, we have here a lot, and we try to address these disparities that we have with health. Health disparity, does everybody has access to it? Health. How is it that this is distributed among our communities? These are some of the issues you want to know. When there is such a thing, and we had a pandemic, does every community have access to the same services? So these are questions that we have. And so you might be involved more in the policy making aspect to it, and how is it in the legal side? Also part of the profession, you might work for a government agency on how to deal with this. So let's stop for a minute and look at it. So we have been giving you this type of background and what is it that you can be expecting to be exposed to it. Let's focus a little bit more specific at this time. So when we're dealing with medicine and health, there are different cycles, part of these elements in this cycle. And that's what we want, as we go through the program, we want you to think about it. Are you interested in the discovery side? But maybe you are more interested in the prevention side. You're going to say, you know, I have a long history in my family or my communities of certain type of cancer, diabetes, hypertension. So I am interested, how can I help with the prevention of disease? The other thing is you would say, well, you know, my aspect is diagnosis. I want to know, how can I contribute to that? How is it that I can be involved in an electronic health record and that it will be alerts, for example, for a physician, for a specialist, about certain conditions that they're having with that patient. And you would say, I'm more interested in diagnosis. What are, you know, the large language models that might help us with it? How is it that AI can help us to not only diagnose, but predict what I might be, the diseases that my family might have due to my genomics, or it might be because certain environmental factors in my community. But then you say, well, no, I'm more interested in the treatment. What are the plan of care that they can be available, and how effective those plan of cares are for a particular individual or for a particular audience? Are this plan of care on target for the adolescents, for children 9 to 12? We know that, or for the elderly, we know that there's certain drugs that they're very targeting certain group of patients. And on the other hand, we know that these drugs, they have adverse reactions and they don't have the efficacy and efficiency that we're looking for. So you say, I am interested in finding out more, have a greater understanding on the treatment. And then the other aspect of these elements in this cycle, it is that we want to know prognosis. Okay, given these conditions that I live in, given to my genes, what are the chances that I might get this disease? And this is where it has become the excitement with precision medicine and how AI is being embedded on this, that it gives us that possibility on the future. Right now, sure, we have been dealing with prognosis forever, and we have been making more and more advances as we embed, as we apply technologies to these aspects in the whole cycle of health. So as you can see, we are going to summarize through the discovery, prevention, diagnosis, treatment, and prognosis. So ultimately, what we're wanting here is for each and every one of you to have a place in our society, in your communities, and narrow it down to yourself and your family to contribute to better healthcare. So hopefully that has given you a little bit of a background. So I would like now to bring to your attention the PowerPoint. Okay. Okay, we're going to, let's see, I'm going to share. Are we all right? Do we have any questions up to now? Please feel free. Please feel free to put something on the chat, and Dr. Philbreck will look at it in monitor it. Oh, please just unmute yourself. We're just happy, very happy to hear your questions and where is it, where are the places that you want to know more about. So let me go forward. And then what we're going to do today, it is going to be, first of all, we want to tell you about the degree requirements that we have. We have certain graduate academic certificates. We're going to talk a bit about your support, student support and development, and then we'll have the questions. Are we all right? So the first thing that we have in here is that we have 2 degrees, I just mentioned it before. And one of the things we're going to talk first is about how we have what are going to be the major requirements. And then we're going to bring up the website just to show you in general, what are the things, the courses that you might be interested in. We invite you all to go to the website. The website have the list of courses. It have nice annotations of what the courses are about. But for the purpose of today's in having this dialogue with you, we want to say that the Master's of Science in Health Informatics, it has basic 36 credit hours. And this is a very exciting program. We are going to have, we have 3 core courses. And right now the core courses are basically one, dealing the introduction to health informatics, and that is 5637. You have, and 2 more courses that they're, that is the introduction to health data analytics. And then the other one that you have, it is what is called 5365, Information Systems in Health. So what we're looking in here is that you're going to have all together holistic in that core courses. It is, learn about what is in informatics and a number of applications to it. You're going to talk about health information systems, of course, which is extremely important because, as you know, we are again, everything is managed. The journey is of a patient, and in the healthcare field is what? It's driven again by systems. And the other thing that we want you to do is to learn the introduction to data analytics. This is very important. And as well as we have a data science right now program, and it will become a department in the spring 2025, we have a close collaboration with them. We have to have the merge, absolutely the synergy between understanding the courses that you're going to be taking with this, as well as courses that they are data science centered. The reason for this is, think about it. How is it that the field of health is really all is about data? That data tells a story, and that story gives the opportunity for the healthcare providers, for the consumers, and those that they're involved in this cycle, it is to get information. And based on that information, it is where they deploy what actions are going to be taken in terms of take care of the patient, actions that they develop. It will be policies for the healthcare systems, for a hospital system that you have. So this is very important that we, at that introductory course, you're beginning to look at data and how can I analyze it. This is the beginning of this course as the springboard for more advanced courses that you're going to be dealing with data analytics. Then afterwards, you're going to have 5 guided courses. And there you will have courses, for example, evidence-based, searching for evidence, 5631. You're going to have, data visualization. So you're finding where is information. What are the evidence for a healthcare provider, for absolutely a patient to make this decision? We want them to have informed decisions. So from there, as you will see, then many times we have to have the data visualized. Many people don't like to have a lot of text, and they don't read it or they don't have time. So having that data presented to you in a visual format it is absolutely impacting more than ever our field. It's a quick way to capture information, and decisions are made of that. Think about it, how many times that we go in and we hear about, okay, there are, so many cases, let's say because COVID coming back, so many cases of a particular disease. And you look at it and say, wow, I have no idea that this disease was so prevalent in our population. And it might have been, you might not want to have read that in a text, but you were interested to find out what are the statistic for diabetes in the Hispanic population. And you might narrow it down to a certain geographical area. And again, it might be just a graph that gives you that. So just to show you that. So that's the guided ones. And then we're going to come to the general electives. And the general electives, there will be more right now that you can be having. And we're going to have to show you actually in a minute the website. And so let's just do that. Some of the general electives, Dr. Philbrick, let's see, do I have to start sharing for a minute? So we can go to the website?
I think I can pull it up.
Perfect. And then we'll come back to this. And then what is exciting about these new masters
and Dr. Cleveland, I don't know if you noticed, if you don't mind if I interrupt, excuse me for interrupting, but I wanted to say that I asked the students to tell us what degree program they're in the chat. So
thank you. I asked them to raise their hand, but tell us at the beginning. So I hope that it's very effective that we got it captured in the chat. I will be there. I'm talking and I haven't looked at the chat. Thank you so much. So we'll take a look in a minute and see how we're doing. So the last course, and we just need the degree overview, please. Yes. So we go to the degree overview. As you can see, we have talked about the required courses, and you have them there. Then you have the general electives. Those were 9 hours. And here you have 5 courses from the this guided elective. And I have talked already about some of them. Notice that some of the things that they're mentioning here in this body of courses is very important, because it also is bringing that social aspect that I just spoke at in introduction. Look at that, legal and ethical issues in health informatics. It's not only that we are going to have to be looking at the health aspect to it, the technology, the IT aspect to it, the data science aspect to it. We're going to have to look at what are the ethics as we deal with health data and as well as information. How do we protect our patients? How do we protect that data, confidentiality and privacy of the data? What are the issues involved in here? What is the integrity of the data that we're dealing with? Since it's coming from disparate sources, how do we know the quality of that data? So these are issues in a course like this that you're going to be dealing with, and we're very happy that we have this course. It was taught for the first time this past summer. So the other thing, look at AI. So here we have a course in AI in health. And this is just the beginning of it. This is the introduction to look at different applications of it. And then from there, you're going to actually be going to more specialized courses that we have, perhaps cybersecurity, the application of AI in cybersecurity. One of the courses, so this is just to mention some of the courses that we have here. Notice that there are 2 courses listed here, and just pointed out to you, we have mentioned several times that we are patient-centric. So we have a course in consumer informatics that Dr. Philbrick is going to teach. And then we have another one dealing with population health. So we are true to what we say. No matter what the other aspect, information science we're doing, the informatics side, the data science that we're dealing with, we're coming back and say, what are the things that we're doing right now? What are the innovations that they're having in the field dealing with the consumer? But then we have to have a largest lens, and that lens is going to be from a population thing. And we are going, and this is a trend, not only here, but I think it is a global trend, because we know, for example, that this right now, diseases not only, they have an impact at the local level, but at the global level. of our well. So let's see then what we provide for you. That is going to be you take 3 courses dealing. The next one, please. Do you mind clicking on it? That's general elective. So we have getting you, and we have 3 courses. And here, notice that we give you more of a choice to say, hey, I don't know much about virtual reality, but I would like to explore that. And how is it that I'll come back for attack in a minute. How is it that, with the question, very nice question. So how is it that you're going to be dealing with virtual reality? How is it that we can train the healthcare providers? Many times we train them, they don't have to be doing it actually in a cadaver or experiment in a patient, but virtual reality is bringing us absolutely another possibility of doing as the simulation aspect to it. We're using incredible things dealing with disaster management and simulating what is it that it happened, in order to train not only ourselves as individuals, but also government agencies, how they can prepare the police department, how they can prepare the EMS, can they prepare the schools? So virtual these and applications, they're great. Dr. Sharma has a wonderful course dealing this, bringing a fresh air, I would say, in the virtual reality to our curriculum. So you will see that there's some other courses here. I want to move on, but what is important about this slide is in here that we're telling is that you can go to other departments, other colleges. We have now dealing with health in administration. We have health information system. You can look at it from that health more from the practitioner point of view and dealing with health administrative perspectives. And how is it that they deliver systems, health systems? And so you have 2 courses that are an option. Okay. Last but not least, what we are so excited right now, that I'm so excited to tell you, is that for the first time this semester, we are going to have what we call the capstone project. And that is exactly what it says here. It is after you have taken all these courses, what you will be doing is a semester long, you will be developing a project, and hopefully you are going to be, we are reaching out to industry and look at the practicality of this project. So altogether, here we have presented what is a curriculum. You will say, are there other courses that I might be interested in due to my background? Because the subject domain that you bring, for example, in dentistry, you might bring it, like I said, in pharmacy. You might bring it. We have people right now that say, I'm really changing my field. Right now, I have been working in perhaps public library, but I have a degree in computer science. I still want to do this. How can I apply? I'm in archives. How can I archive the history of medicine? And so you're going to have to know something about this and go as well. And you might be a candidate to come to this degree. So this is why we have put together for this particular, the curriculum that you have in place. Is there some flexibility? Let me tell you again, yes, you might find a course dealing with anthropology and geography anthropology, and you say, this is something that I think it will help us. You might find a course in dealing with geographical information system. Will you be able to do that? And notice what we have been highlighted now in the screen. Students may take courses other than the ones listed below with your advisor approval. And I'm the one who will be, at this point in time, who will be giving the approval for those courses. Along that, there are other institutions that you could tell that we have partnership with the University of North Texas Health Sciences Center. And you might say, well, they have, they're dealing the health department, the School of Department of Pharmacology. You might say, I want to go and take a course and expand more my knowledge base. We will have to look at the collaboration, what are the courses, and how we're going to transfer. Thank you very much. Dr. Feuerberg, shall we go back for a minute? So we have a question right in the chat. I saw. Do we have some questions in the chat?
Yes, we had a question from Pratap.
Yeah.
Dr. Anna, could you please clarify the process for course enrollment for MSHI students who secure internships? Since the curriculum includes a capstone project, but no designated internship course, I'm wondering if students are required to enroll in both the capstone and a special problems course when they have an internship, or if the capstone project itself serves as an internship course.
Thank you, Pratap. That's a very good question. There have been an exception, and I'm sure you bring it up because you were signed up for an internship. That was because of the depth that we had at the time of your internship. And also that course was not going to be started until fall of 2024. Right now, if the students are in the MSHI, they are required to take the capstone, and the capstone will serve as the internship for that program. So what we're looking at, we look at specifically the student, their interest, and then we design the internship for them for a semester. Saying that, I will say that there might be exceptions, and there are always exceptions to a rule where there might be a special problem due to the nature of the project that you will have that might be very comprehensive, and we might explore that. So I don't want to close the door, because I think that one of the things that we have been very successful, it is that not only we look at the curriculum that we have in place, but also we look at the career goals of the students. And there are certain times that we have allowed to take this course to meet those career goals. So while we have definitely a prescriptive, it is absolutely, and we have described it, the degree plan that you have seen here just a few minutes ago, it is always in consultation with the director of the health informatics program that you will have some options. After that, we will have to, or you must start with the advising office, which I will know is your partner in trying to look, for enrolling in courses, that there will be a communication with that particular staff, and then they will reach out to me, or the process can be the other way around. There's always a very open line we have, and I want to establish that right here today between the advising office and their staff, as well with me, Anna, as the director of the program. That's the only way that we can be successful in putting your plan together. So Pratap, I hope that this answers your question. Where's Pratap?
Yes, Dr. Anna. Thank you so much for clarification.
Yes. If you have any other thing, do we have any other questions?
No, Dr. Anna, I'm good.
No. Anyone else in the group? We have, okay.
I will say, Dr. Cleveland, that the majority of the students mentioned that they were in the Masters of Health Informatics, but we do have a few students that are in the MSIS.
Thank you so much. Okay, so saying that, that's the curriculum. Shall we go back? Just for a minute. So because we have a few students in here, EDS, dealing with the Masters of Science in.
Did you want me to pull up the website?
Yeah, let me just say it, guidance, perfect, and then we go in a minute with it. So we are going here, just like we did before. So this is an overall bird eye view that you have in here, but in terms of.
Dr. Anna, we can't see your screen.
Oh.
You need to share it.
Oh, I thought I had to. Okay. Bear with me in a minute. We're going back and forth, so we're not there yet. So thank you. So here's the Masters of Science in Information Science with Healthline Librarianship. And because there's some of you could see that you have the 3 core courses. And of course, this one, we're dealing with 3 core courses. They're going to be the 3 courses that they're going dealing with the Masters of Science. of information science. So you will have 5,000, 5,600, 5,600. And then you're going to have 2 guided electives in here. And that we are giving you, for example, you will see in a minute, a systems course, a project management course, data modeling, data visualization, and you select 2 courses of that. And then you have a concentration requirements that there are 4 courses in that category, and then the general electives that we have 3. So let's, at this time, for the interest of time, Dr. Philbrick, how about if we bring the curriculum for that? Okay, so as you see, we just mentioned that the core required courses. Let's scroll down, please. Okay, so we have the guided electives that I mentioned, the system and the project management, which right now project management is a top topic. Everything is, we are having nothing but projects assigned in our workforce. And are there certain principles that you have to see? How do you manage a project? How, from the very beginning, how do you set the goal for the project? How do you do the timelines for the project? What are the deliverables to it? So this is important now. And then you have 2 other courses listed there. You only take 2 courses in here. Now, let me stop here for a minute and say that if you are in the Masters of Science in Health Informatics, will you be able to take a project management course? And the answer is yes. You just have to reach out and say, Dr. Anna, this is something that, I feel like I need to develop more strength on this. And that would be fine. So the concentration requirement, you have them listed in here. You can see that it's a broad variety. Let's keep going on. You take 3 of those. The general electives, you see them again. And the general electives that you have to take 9 hours. And again, you could see that there's an overlap between one degree and the other. What you might have noticed is that some of the courses, they have a HINF as a prefix. And some of them, when they have an INFO. If you are in the Masters of Science in Health Informatics, you are really required to take, I would say, the majority of all the courses you saw in our inventory dealing with HINF. So you say, why is this? Well, it might have the same title or a similar title, but when you are in the HINF courses with that particular prefix, the emphasis is in the informatics side, is the emphasis in the technology. What the courses they have, the INFO, is mainly information management. So you might be looking at, a health information system, a course, but if it has HINF, it will be definitely in-depth coverage about the systems, about how is it you go about managing those systems, what are the issues that you're going to be facing to it. You might even look at some of the courses, some of the assignments, it is a bit of a mini design of the system. So it is different. When you take it in the Masters of Science in Information Science with this concentration that we're talking about right now, it is in information management. So you will go in and look at, okay, what is in this information system? How can I embed, for example, references, citation? If a patient is diagnosed with diabetes and it is an Afro-American student, a child 7 years old, and he have other complications, I go and do a literature search. And how can we embed the results of that literature search in the electronic health record? So when you have a healthcare provider that is looking at this patient record, you say, oh, there's this evidence, and how is it that they can impact their plan of care or their diagnosis, and then how is it that they're going to treat that particular patient? So that's it. Okay, next, please. On the general electives, can we just move on? Okay, so the point in here, up to now for this particular degree, you're going to have an event, and we can go back now to the other. Oh, we want to show the graduates academic certificates, please. So we have
I think also, Dr. Cleveland, we want to mention that if you're
the capstone. What?
Yeah, I was going to say that.
No, yes, that's what I was looking at. And then I said the certificate before.
Yeah, that if you're in the MSIS degree program that you have the requirement of the practicum internship.
Yes, Uncle.
Okay.
Perfect. Thank you. Thank you. So those are the 36 hours that you have listed that we did. So there are two more things that we have. And that is that you have a practicum required. And as you could see, can you see my screen now? Can you see the screen?
No.
Or not? Huh?
No, you can share again.
Okay. I'm going to just go from here.
Go.
Even as we're working this, we're going back and forth. So as you can see from this slide, there's really two more things that you have to do. I'm talking now for those few students that are here with the Masters of Science in Information Science Health Librarianship. You need to enroll in a practicum, an internship, what we call 5090. But also you have the possibility to apply for a waiver. And as we look at the waiver, we look at what has been your experience in the field, what do you do, and it has required also that your supervisor signs the form and give us an indication of what you did. So the other thing that we had to do up to now, this group of students, you have a capstone experience, what we call the portfolio, and there will be more information on this and the website, and there's a committee. And actually, to be honest with you, we are looking and seeing what are the requirements that they're going to be for the capstone. Stay tuned, because there might be some changes. So we have presented both masters in here that we have in place. And thank you for both of you to listening, because both of you can benefit from it. So in addition to that, we have been very pleased, and we had the Health Data Science Graduate Academic Certificate, that it have 3 required courses. And looking at the time, so we can go to that webpage and you can look at it. So, and it has 1 elective, so you will have 12 hours. So what happened is that once you finish your degree, you can take you will have been smart, and you have been taking some of the courses that they count for the Health Data Science Certificate, as well as for your master's program. And these apply for both masters that we have presented in here. And then that is going to be the Health Data Science. It deals more with data science, as is indicated in the title, because what we want is the students that might be dealing with the Masters of Science in Information Science, in Health Librarianship. They say, I want to come out with a certificate that gives me some confidence, that I have some basics dealing with data science. The other certificate that we have is the same number of requirements, the Health Information, and it's focusing more in health information management courses. And then why is the purpose of this? Well, we might have some individuals that they're dealing with absolutely the data science aspect, the informatics side to it, but I don't know much about how to match information. For example, key course in here, searching for health information and so forth. So you will have this. You can get out of here from this UNT, from our Department of Information Science at the Pro, dealing with your master's degree, as well as 1 or 2 or no of the graduate academic certificates. Another benefits that I want to tell you about the programs that we have right now, it is that as you go through the core courses that we have for the Masters of Science in Health Informatics, the 2 courses you're dealing with, HI and F, 5637, the introduction, Health Informatics, as well as 5365, the Information Systems in Health. You will come out, if you enroll in those courses, you have a Coursera certificate. And the certificate that you will get, it varies with this semester. Some semester we have a requirement that you have to do SQL, another semester Python, another one R, and we look at the enrollment, of course, and we have a rotation to it. Now we're dealing with clinical data. So this is very positive. At the time you come here, look at the line items that you can have for your CV, in your resume. Hopefully this is clear. So there's something else that we want to tell you. What we provide for you, absolutely, without a doubt, we are very proud of the learning, the academic activities and courseware that we provide, and the faculty that is involved in this. And we have a wonderful faculty dealing with health informatics at the time, and we are expanding it. At the time, we're having more hires. This faculty, what they will provide all this knowledge that you will have, plus the mentorship that we provide. We also have student organizations. And so for those of you, and it doesn't mean that if you are in one program, you cannot belong to the other program. We have now, for example, the Health Informatics Student Organization. He saw that it was established in last year. And we have a number of activities that we provide as support for the students, very active. And for example, Pratap, that we mentioned him before, in here he was, let me see who the people here, the vice president. I know, I believe that Dr. Ala was here. She's the co-advisor of this. We might have some other students, officers in here. So we have a pool of positions from social media, the treasurer, the secretary, the president, which is very active, and so forth. So this is an organization that is emphasizing bringing workshops and activities as well as social. And then also we have LISA, which is the Library and Information Science Student Association, that it will be a lot of the students that they are in the Masters of Science, Information Science, they would like to get involved, and Dr. Philbrick is the advisor for that, and I am the co-advisor with Dr. Ala. So we provide some student support for you outside the classroom for you to have to network with your students. The other thing that we want to mention in here is that what we bring a panel, for example, of professionals that come and share their experience. Sometimes they're recruiters. They offer internships. We also have something that we have become very well known for the last 5 or 6 years, and that is the Health Informatics Lecture Series that is offered in the fall and in the spring. This fall, we're going to have it in November 6th, and it's going to be dealing with machine learning to identify patients most likely to benefit from pharmacogenic testing. And as I mentioned before, we look at who is the audience right now in our program, what are the demographics, and we noticed that there was a lot dealing with pharmacy. We thought we bring an expert dealing with this area. But the topics vary every single semester, and also usually they are national and international experts in the field. So it is a connection for you also with the possibility of network, and we have had that with that. The other things that we're starting this semester to support students, it is that, well, you might have heard the word lab before for the health informatics program. Yes, we have had it in the core courses, which we have considered the core courses, 5365 and 5637. There is a lab every other week to support those students that they're taking those courses, and many of them, this is your first semester, so we help to launch. This semester, we have a new initiative, and that is the Health Informatics Lab, and we're going to have office hours. We are very pleased, and I want to publicly thank Dean Kenchik, who have really worked hard that we will have a Health Informatics Lab. So we are excited about that. It will be a lab that we are going to focus on doing research with the faculty and students, but also we are going to provide on the first Mondays and third Wednesdays of the month, we are going to have from 2 to 4 in person or Zoom office hours. You will come in and we can see what your courses are. You can say, this is what the project that I'm working on. You can just share with us what is it that it is in your mind right now. What are your needs? We want to meet them more specifically, that you have a time that it has been assigned for this purpose. So at this point, of course, we have tried in this hour to give you such of a general overview, and I noticed that we have 10 minutes in to see if we have any questions from the audience. What are things that, okay. I'm going to stop sharing. So you have a great semester. And we're bringing it now back to the main room. So what do you think? Do you think this is an exciting area? You might want to see some of the areas that we're dealing with. The research, we have been doing some very interesting things dealing with disaster management, looking not only who are the literature, who is publishing, what are the topics of interest from a consumer point of view, from the point of view of the scholarly literature, what are the centers that they're doing research, and especially we focus on COVID. We thought this would be a very nice application of also look, for example, how to extract data from the literature that we have come up with. We are over 7,000 articles, and we studied just for about 4-year period during pre-pandemic and post-pandemic to see what were the sentiments that existed. So that has been a very productive. We're about to go into publishing the article. We have made a number of presentations. Dental informatics, we have also looked at the literature because we are concerned. How is it that the dentists are being trained? How they have been educated in dealing with informatics? How is it, what are the applications of electronic health records in the practice of dentistry? What is the data that we are coming about, diseases related to dental health, and looking at this at the literature and making a content analysis to it. We have been dealing with information-seeking behavior, for example, of underrepresented population, how they look at the genomic literature. We have been looking at social media and tweets and sentiments of it at different periods of time. So this is just to give you the tip of the iceberg of what we're doing. I mentioned we have Dr. Ala, that she's doing a research right now in ADHD, which is attention deficiency, disorder. And how is it, what are the drugs, the adverse reactions of this drug? Are there any efficiency, effective, positive things about some of this drug? And when she had noticed that a lot of these drugs are mainly aimed at the youth. What have been the side effects? How is it that we can communicate that in a more focused way to those that they're pediatricians or that they're dealing with this particular condition or disorder? So these are some of the things, just to bring you as an example of a student. We have some very interesting internships that we look, and this is just to mention what, Pratap, will you mind to tell them where you did your internship? Because it's an unusual. We're open for the students to do internship in clinical facilities. We're in research facilities, and then something that might be not ordinarily that you might think. Pratap, in 2 minutes or so, would you like to tell us how is it that you did this internship?
Yeah, sure, Dr. Anand. So I was searching for internships from the end of the first semester, and I applied for thousands of applications. I got most of them were rejected, but I'm not disappointed. I continuously applied, and finally I got an interview, and I gave my best. So I worked as a uh, uh, healthcare intern. So most of the time I worked on EMR, but that's a CAM setting, so it's not very widely used EMR. It's a UltraCam. It is called UltraCam. So the major work I have done in it is entering the data, health data, and also retrieving it and providing the information whenever the health team needed the specific information. And also I come from a health informatics background, so I know data analysis and sort of visualization. And also whenever they asked me for data, I gave them the accurate type of data and also like easy way to understand. They were very happy about it because not everyone know how to do it precisely to understand. So and they needed some data which was like people coming with major complications. So I have given them that. And also whenever they need some first aid assistance, I was there because I'm from a pharmacy background and know what the medications, how they treat, and also whenever they need some OTC medication or something like that, I was there. So yeah, majorly I have done EMR and also assisting in the first aid and also OTC medication. Yeah, I had a
So,
wonderful time.
yes.
It's the camp setting, so I enjoyed a lot working with the like international people, not just from US or India or China. I have seen like from Germany. So it's a wonderful experience. Uh, I worked in Concordia Language Villages in Minnesota. Yeah, thank
So
you.
thank you, Dr. Pratap, to share that. So that was an unusual thing. So, you would say summer camp, when he came and said, Dr. Anna, I'm interested. What do you think about this? Of course, my eyes light up. I'm always looking for something new, innovation, but also how can it contribute to his career goals at the end? So this is just to show you today that there are all the opportunities that they're all, available to you, and you have to explore. So I want to, before we close, and I want to see there more questions that we would like, because we want to answer your question. I want to put a plug for professional associations. I think it's extremely important. Some of you might go to, the American Medical Informatics Association, and with the Health Informatics Association, the student organization, we are going to see how we can launch a student chapter. We have a wonderful thing with those of you that are in the health librarianship aspect. You have the Medical Library Association. We have a meeting, and believe me, we are just sent Dr. Philbrick and I letters for the students to get apply for different awards that they have, and hopefully we will get them. So, it's the way that also the faculty that wants to mentor you. That's another thing. We want to mentor you. How can we embed you in the profession through professional association? Last but not least, do not ignore the social media platforms. Linking is extremely important for you to have a presence. And that, again, we're going to have a workshop with the Health Informatics Student Organization, which will be open to everyone, all the students. How is it that you can use and benefit the most from using a social platform like this, like linking? So from my end, I just want to tell you, hopefully these have provided an opportunity for you to see so much that we have to offer for you. We are very proud of what we have at the time, but we always are looking at ways to improve. So it's extremely important that we hear from you. Your questions lead us sometimes to see, we need to expand on this. We have to have new initiatives to it. So don't be shy and communicate with us. That's the only way that we can help you and make our program even more successful. At this time, I want to thank Dr. Philbrick for joining us and helping with this, and those who have spoken, and Dr. Pratap and the other ones. I'm looking forward to meeting, and if I haven't met you before, to meeting you. We have an orientation for new students in health informatics. On September 14th, you will be hearing about it, and then we're going to have a network fun thing September the 20th, and they're all both will be at Discovery Park. And so with this, do we have any questions? Hopefully this has been very, very informative for you. You have raised questions and more things that you want to know about us. Are we okay? Any comments? Yes, no?
No questions in the chat.
All right. Well, so no saying this.
Well, we wish you all a wonderful semester. And as Dr. Cleveland mentioned, please feel free to reach out if you have any questions that come up after you've attended the session or throughout the semester.
Yes.